Time now for this week's Health Matters. Paul Critz, KFUG Community Radio, and our host, PA Lynn Szabo. How you doing?
I'm doing good. I'm excited about this topic.
This is an interesting sort of topic, yeah.
Kind of out of the box,
Okay.
but I think it's real.
All right, well, how are you going to get us into this? Because I can't even think of a way to...
I know. Cuba and China, what can they teach us about access to care in Del Norte?
Wow, okay, all right.
Yeah. Oh, my gosh.
So you mentioned at the very beginning of the notes here, the barefoot doctor. Could you hit people who might not know what that was?
So that comes from China. Mm-hmm. That was a nationally institutionalized policy that happened between 1930 and then kind of petered out around 1980. And it was personally embraced by Mao because he was concerned about the discrepancies in quality of healthcare between rural dwellers and urban dwellers. Whoa.
Yeah, wow, okay.
Yeah.
Wow, all right.
Yeah.
And of course, everything and all the problems that we might have here in Del Norte are just magnified by 1 billion in China. But that's an interesting sort of insight to have.
Yeah. So what they did was they pioneered this system that coordinated healthcare providers for rural communities, and they also had a secondary plan, which I should say they were trying to get people less focused on traditional Chinese medicine and more focused on, what they saw as modern medicine.
Oh, interesting.
Okay, so there were two things: access to care and updating standards of care. Mm-hmm. And so they took people out of the communities who were kind of somewhat, well, first they took doctors and assigned them.
Okay.
To the country.
Right.
Okay. And that worked, kind of, but they were only, they were only staying there for a couple of years and leaving. Sound familiar?
Yeah, that really, really does. So, I mean, do you know where the doctors just told, like, you live here now?
Yeah, there's no, like, shopping.
Yeah.
Anyway. So then what they did was they took either people that were a little more educated than the average Chinese citizen, rural Chinese citizen, or they took people that were admired by the community, like the already established Chinese traditional medicine practitioners, and they kind of scooted them into kind of pseudo-medical roles. So they weren't really physicians. You could argue maybe these are the first PAs and paramedics.
Right.
They weren't really nurses. And so they just kind of created a space where they could practice kind of a bridge, not only in availability, but in kind of medicine they were doing. So kind of exciting.
So it seems like the goal was like that first healthcare provider that triages you, right? Or assesses and
paramedicals. Yeah.
Right. To have, I love the numbers here that you have, the goal. Or that they had, rather. That's interesting.
So, but the focus was on the hygiene, preventative health care, family planning, and treatment of common illnesses. So they were probably, it didn't really say in my references, but they were probably also setting up kind of a referral system. So if you have something weird, that could get you to the city for more experienced help.
So basically describing like roles of like open door here, right? Yeah, that's interesting.
Yeah, and we'll go into that because open door is related to this.
Oh, I'm sorry. I didn't mean to.
Dun. So the goal is to have for every 1,000 citizens, they wanted one barefoot doctor.
Wow.
And so that's what they called them. And the reason they called them barefoot doctors is these people had side gigs. And so they were oftentimes laborers, and they were working in the rice paddies, and apparently you don't wear shoes when you're standing ankle deep water.
That makes sense.
So they called them the barefoot doctors. They weren't really physicians, but they had a little bit extra training, and they were kind of a bridge between traditional and more advanced medicine.
And just a very real, like community-based healthcare here.
Right.
Wow. Okay.
And it was so well received that they ended up having about one barefoot doctor for 750 people, which is super good access to care. So just
do you have any numbers?
Have a comparison set of data. So
how are we?
My practice at UHS is I for one of me there's 1,247 patients.
Wow.
Okay, so one kind of ancillary healthcare person for 750 is super good.
Yeah,
super good.
Oh my gosh.
Yeah. So let's see. The one cool thing, too, is that there were women. They focused on women because women's health care was super important. And they were able to demonstrate over the decades that barefoot doctors were a thing, that they not only improved health care and health standards in general, but specifically they really, really improved the quality of life for women. So decreased morbidity and mortality for women, probably related around childbirth, things like that.
Right. It seems it says here too in your notes that they had graduates from medical school, that you graduate from medical school in China.
Yeah,
and
they
then
had
do
a little
couple
mentoring system set up. So, if you were like part-time rice paddy guy, then you weren't like completely alone.
Wow.
Yeah. So
okay. So the
super cool.
graduates or the fresh doctors fresh out of school would be there sort of as a support for the community based,
Right.
the barefoot
Right.
doctor.
And I think also to keep the focus a little bit less on the traditional Chinese medicine and more toward modern medicine.
Right. Yeah.
So super well thought out, super successful, went for decades. And of course, like all good ideas, was taken by the World Health Organization and is also used in many venues worldwide.
Really, still okay.
Yeah, kind of. And so this, you could argue, was like maybe one of the first PAs.
Yeah.
I don't know that Eugene Stead, who is the person who started my profession, would necessarily have been inspired by this, but you can see the similarities, and so people grow into their practice, and as they're able to do more, then they become more valuable to the society. So Jerry Brown, this is the connection with Open Door in Humboldt County, maybe even Del Norte. Jerry Brown, in his first term as governor, was really focused on this idea. And so he used this generalized idea to increase access in medical care to rural communities. And specifically in Humboldt County, some people who've been around for a while might remember that CR used to have a PA program that was associated with Stanford. And it was mostly Stanford in name only, but it was more administratively associated with De Anza Junior College. So it was CR and De Anza Junior College. And they actually kind of sponsored a whole generation of PAs that were committed to working in Humboldt County. And so they picked people that already lived in Humboldt and maybe Del Norte, and I think historically there might have been one Del Nortean. And what they did was they gave them free PA education. So just for reference, a PA education right now for a little bit over 2 years can cost up to about $250,000.
Okay.
So when I was in school back in 1985, $32K.
Oh, wow.
So
okay.
it's only going up, right?
Yeah.
So to be given a career like this for an interested party who's committed to the community for free, and that was a fairly good level of education. It was focused on preventative medicine, primary care, women's health, children's health, that kind of stuff. So I can think of about 5 PAs that I've worked with in Humboldt County, all of them working in Open Door, who got their start initially from that program.
Wow.
And a lot of them worked for 30 and 35 years, and they're kind of like retiring. They're kind of fading out right now. So we have data, and they were all good providers, and they were all committed to community, committed to primary care, which is what we need.
So,
yeah.
No idea why you should even know this, but were they from? I mean, do you have any idea? Were they from here? Did they come here? Were they drawn
weren't
here?
Really born here, except I think maybe one of them was a local guy, the Del Nortean guy. But they were. One of them was the first administrator of Open Door. I can say his name, David Horowitz. Okay, so he was not a medical person. He was a community organizer. And he became less interested in community organizing, so he was part of the panel that hired Herman Spetzler. This is like 100 years ago. Okay. And, he's worked, and he was set, to College of the Redwoods and then pseudo Stanford program for free. And he's been in practice probably approaching 45 years now.
Wow.
He's one of the most intelligent and compassionate providers I've ever met. And he's always taken care of the least among us. So he works at the 10th Street Clinic. They get a lot of the plazoids, or people kind of transient off the plaza. And he also works with people with HIV disease. He's kind of the originator of trans medicine for Open Door. So has done amazing things. So this mirrors some kind of research I was looking at, is that these people tend to stay in the community, they tend to stay doing preventative care, and they tend to have long, productive careers.
Wow.
So not only, do you have an improvement in the healthcare of the individuals in the community, so the citizens, but you also have a really productive person who makes their life serving the community.
That's remarkable.
Yeah.
That really, really is. And I had no idea that Jerry Brown had done that. That's wow. Okay.
Yeah.
It almost is like it's like a Peace Corps for healthcare, almost, in a sense.
Vista or something.
Huh?
You remember Vista?
No. What was Vista?
That was Peace Corps for the United States.
Wow!
They would send people into communities in the United States, like maybe reservations.
Why isn't that still
or
a
inner
thing?
city and stuff? But this is specific to medicine,
Right.
and these people were handed their careers, which is
Yeah.
wow.
Yeah.
And
Basically,
I spent 10 years paying my off, and now people are spending a lot longer. Incredibly expensive.
but just being, and I wonder if it's just. Do you attract with this sort of situation and this kind of deal that you get as a wannabe healthcare provider getting ready to go to school? Do you attract a specific kind of person to a situation like that? Instead of I'm going to go become a doctor and then go find, and this is so broad brush painting here, but going to go find the most lucrative practice I can have somewhere and set myself up. It seems like, if I were, just embarking on going to school and somebody was offering me, first off, a free education,
right,
and then a guaranteed job afterwards. Right. I mean,
there's a little risk involved at the time because the PA profession was new, and there were a lot of interest groups trying to kill it.
Okay.
But it hung in there, and it's thriving now. So I think for somebody to be offered a PA education for free with the condition that they stay in a community they're already established in, I think it would be a hot selling point.
Yeah. It's not just healthcare. You could do that with a lot of positions.
You totally could.
Yeah. Huh.
Yeah.
Okay.
So go Mao.
Yeah. Well, maybe we won't put that on the banner.
Yeah,
All right. So that's how we could learn from China. And of course, China, the jury isn't exactly out anymore on whether or not their civilization is going to survive. Right. I think if an alien were to land on our planet and look at it really from a meta scale, it could be identified as a Chinese planet. But it's just, what about Cuba? Because
Cuba, this is specific to the question of why we need more doctors.
Okay.
So the world's largest medical school is in Havana, and with extensions throughout Cuba and also into Latin America and weirdly South Africa.
Oh no! Well, in South Africa, huh? That's interesting.
Yeah. So the school.
Angola? I'm trying to see how that would work.
It's probably other countries too, actually. It's where there is need, where there's poverty and need. Yeah. And that's where they are. So they're called the Latin American School of Medicine, which is ILAM in Spanish. Okay. So they accept they have about 19,000 students. So just for reference, my PA class back in 1985 was 37 people.
Oh, wow, really? Yeah,
so 19K students from 110 countries.
Wow.
So can you imagine the entrance requirements are super variable? They kind of have to be because everybody's coming from a different background.
Well, or very basic, and it's a line that everybody can meet,
And we'll talk about that in a second. So their goal is to educate socially committed physicians from low-income families.
Wow.
Okay. So that's kind of what we want. And that when you graduate from there after 6 years, you get the same degree that U.S.-trained MDs have.
And so what? Is that like a 4-year difference? What's the typical time?
Well, medical school is about 3 to 4 years for, let's say, average med student at Stanford.
Okay, after...
And then they go on to other stuff, and they oftentimes specialize. And, it's probably worth saying that most medical students start their journey like really idealized and wanting to help the community, and then like the grind and the money needs and stuff kind of grinds them down, and then they end up being plastic surgeons in Beverly Hills.
It's not, and that's understandable on a
Right.
certain, because it's the grind is just incredible, right? I mean, it's going to change it.
I went 72 hours without sleeping. I was hallucinating.
Oh my God.
It was trippy. But yeah, and I was, I went to a tertiary care medical center, and I was on the same team working, but not at the same level that the medical students were.
This is maybe just a conversation at some point, just separately, or maybe a whole episode. I'm not sure, but just is medical school is medical school a traumatic experience? Are people traumatized by going through all of that?
Yeah, I think some people are.
Yeah, it seems like almost like basic training, but bigger and longer and more intense.
But there's aspects of it that are really fun.
Yeah,
To be immersed 100% in medicine is like, wow.
Right.
That sounds like fun to me. Anyway,
well, a patient walks into your exam room, you're going, oh, I hope it's gory. I know you. You're like, I hope it's something I have to suture. Yay, this is fun.
hey, pause. Anyway, so this is a school where being poor, female, or from an indigenous population is an advantage. Oh, wow. So, if you think, look, I'm preparing my resume or my application to get into med school, and you want to highlight this and that and this, but in this case, if you're preparing your application, this is what they're looking for: poor, female, or from an indigenous population. So that's kind of stuff we have here.
Yeah. Well, those poor and indigenous and women people are everywhere. But yeah, that is very much a heightened situation.
Right.
What we've got going on here. I love this lesson. My next question was can people from the United States qualify for this school?
Yes. So they're specifically looking for candidates from the poorest communities worldwide, and that includes the U.S.
Wow. And
specifically medically underserved communities. Hello.
Hey.
I mean, that's us. Right?
Oh my God, who can we send? I'll go.
I'm getting to that.
Okay.
Yeah. So here's one thing to consider. Classroom lectures and reading are conducted in Spanish. But this isn't that difficult. I worked my first supervising physician was a United States citizen who was educated in Padua, Italy. Mm-hmm. So they have a lot of world-renowned medical schools there. And so his ability to understand Italian was about zip when he got there. And it was kind of funny because as we worked together and knew each other, he would be looking at anatomy and he would be mumbling in Italian.
Oh, wow.
So he's got everything learned in Italian. That is not that unusual.
Sure.
People are trained overseas.
Well, no, and you get immersed in it and you have to deal with it every day and use it.
This school is thought to be really like graduating amazing people.
Well, and if you're going anywhere, but if you're coming back to the United States and you've had to go to a medical school, then you have to do it in Spanish. That's just another tool in your belt to come back to the U.S. and be able to speak Spanish.
If you came back here, that would be another good thing, another gold star. So they have full scholarships, okay, that which includes tuition, books in Spanish, probably online. I don't know how much internet they have in Havana. Probably books.
Wow, yeah, no clue.
Yeah. Accommodations, so they live kind of in really, sparse dormitory conditions. Mm-hmm. And they get a small stipend, and it's $4 a month.
Oh, wow.
So that's apparently...
That'll get you through?
That's usable in Havana.
Yeah.
Yeah, super, super cool. So they take people from all over the world, and you don't necessarily have to have a college degree. That's what blew me away, is that if somebody has a high school education, in some circumstances, that's enough to dive into this.
Mm-hmm. I could see that, yeah.
And they also are looking for people that a specific community is saying, hey, this kid is worthy. Mm-hmm. We think this person, this trained individual is going to come back. Mm-hmm. We trust them to lead the community. We want to mentor them for our community. This is who who we're sending to you to get these skills.
So is it a conscious goal of this school? And I think you may have said this, and it just, all the amazing things you're throwing at me, it didn't catch. But that the people who are recruited, who successfully apply and get in, that will go back to their communities. It's just not dropping them out into the world at large. Well, go be a doctor somewhere. I mean, specifically, this
right
is
after their training. There's a little bit of dropping them in, here and there while they're training. So their first 2 years are didactic, and what that means in medicine is you sit and you listen to lectures, and you probably have skills labs and stuff like that.
Yeah. But is the goal for everybody expressed to
get back to where they started?
Is that the goal?
That's the goal.
Okay, cool. That was my question.
Goal.
Yeah. Okay.
Yeah. So after you do the 2 years of didactic, then they move you to other campuses, which they implied were in Cuba, but I also kind of think might be in places in South America and South Africa and different communities like that. Now, would you come back to the United States? I wouldn't be surprised if that was possible, but I think they feed these students more into Latin America. So super cool. 6-year programs, and that includes an intern year. So that means you're going to be practicing at a really high level in Spanish with few resources in the middle of nowhere, surrounded by poverty.
Wow.
I know.
Wow. So and for you, that's just another Tuesday. So what's the...
No, I think this is even more.
Okay, even more.
Yeah, because I live off more than $4.
Oh yeah, good
month.
point.
But
Good
anyway.
point. That's true.
So, and this is what kills me. This study, so all this rigorous study in a foreign language happens in an environment that, the quote unquote, recognizes the right of every patient to care and health promotion as an important part of disease management.
What's that mean?
That means it's super respectful to the patient. Okay. So there is nobody jonesing around saying, "Hey, I'm just here until plastic surgery opens up."
Have you shared this information? I mean, this sounds really expensive. How much does this school cost?
It's free.
Yeah, there you go. See?
Yeah.
That's amazing.
And another interesting thing is a weird number, but 111 people graduated. No, sorry, were accepted into the school from the United States last year.
Wow, good. Just
So
U.S.
it's a thing.
It is a thing.
It's doable.
19,000 students. Any idea how many students graduate each year?
I
would
heard
assume
people say about 1,000.
About 1,000, yeah. Wow.
I worked with Uzi Seltzer, who is an infectious disease physician who serves both Del Norte and Humboldt on a consultation. But I worked with him when he did a brief stint in urgent care. And he was trained in Mexico City. So born in Israel, grew up in Argentina, but trained in Mexico City. And he says this is and he has high standards, believe me. This is a really respectable way to get a medical education, and it's completely doable.
I guess that was my next question too, is how does an education at Elam compare to, say going to a medical school in the United States, other than the
2
cost?
years longer.
Which is in Elam. But but I mean, so you're coming out with not just, it's comparable education.
Yeah, I think you probably have to go through an application process to practice in the United States, but that would be for anybody.
Are there boards? Are there exams you have to pass? Or
I would not be surprised.
Okay. I just don't know how that works.
Yeah, because there are tons of them all the way through, somebody's medical study.
And is it a conscious? I mean, is there a conscious connection? I'm asking you all these questions that maybe you have no way of knowing. But I mean, the school in Cuba, it seems like it just really is built upon the Chinese model from earlier. It just seems like a bigger, more early version.
I think Castro thinks it's his idea.
Oh yeah.
But anyway, I don't care. As long as
it doesn't matter.
As long as they turn out doctors. And there is an organization in Oakland called MEDIC, MEDICC. You can Google it. They have a lovely website, which identifies itself as an institutional bridge builder.
Okay.
So they kind of mentor people, presumably from the United States, although I would imagine it would be anywhere. To get into this medical school.
Oh wow! Okay.
And if they're my big question right now is if they're accepting people with just a high school education, say from South Africa or something, does that mean they would do that from Del Norte? Because that's another barrier that would disappear.
Am I wrong to assume that a high school education from another country might be a little better than ours?
Or it might be a little worse. I don't know.
I don't know either,
I don't know about equivalencies, but this is a group that can answer that question.
And if Elam is a 6-year school and you're getting 2 more years with them, then maybe they're backfilling some of that and just making sure everybody's sort of at the same starting
knows
point.
The chemistry and all that kind of stuff. I don't know, but if I was a Spanish speaking, bilingual high schooler at Del Norte High, super interested in medicine, thinking that the only way I could get in would be the CR nursing program, I would be talking to Medic in Oakland and seeing if this is doable.
Yeah.
If I was committed to this community, really wanted to come back, is this something that I could make happen? And for 111 people, apparently the answer is yes.
That's an amazing opportunity.
I don't know. And so, Sue, I don't know much about, my kids went to high school in an alternative school in Humboldt County, but are there career counselors like at CR or Del Norte? And do they know about this? Do they dream big and out of the box?
First off, I have no idea. I have no idea what career counseling in modern
really
education is. I remember what it was for me, and look what that did. I'm just assuming that any career counselors we have here are just trying to funnel people into law enforcement or corrections or something,
right, or nursing, or like
nursing
or CNA,
right,
yeah,
and that's a big deal. That's a big deal.
It's
just
certainly needed here in this community, but for the right motivated person, like it would take a lot of motivation if you didn't speak Spanish to land in Havana, and somebody says go, and then you
go to school.
You pour like 6 years of your soul into it, but you come back here really with the skills to really help this community, and it seems doable. But I don't think anybody knows about it.
And it's just what's to stop? Why doesn't one of these billionaires who are obsessed with going to other planets just set up a school like this a couple of schools like this in the United States? How much money would that take? How much skin would that scrape off of your butt? Any of these guys to set this up? I actually
think it's a lot less in Cuba than it is here.
A lot what less in Cuba?
Because medical education here is expensive.
Sure, and that's why I'm saying why don't one of these billionaires who wants to really help the world, blah blah blah, set up a couple of these schools in the United States?
They're taking a hammer to capitalism, and that's not in their long-term best interest, in my opinion.
And here's my next question: what are we to take away from the fact that both of these community healthcare models that you've built up that are both like sort of grassroots and then a more meta education and spreading out around the world, that they came from communist countries?
Well, didn't stop Jerry Brown.
It kind of stopped Jerry Brown because I don't see that school or anything here now. And what's happened since then?
I think the structure of the school changed. Okay, and I think the Stanford program is now more Stanford oriented and less JC. And I think that PAs went from having AA degrees to now masters with the talk of PhDs. So I think the whole profession grew beyond that particular aspect of it.
What particular aspect of it do you mean?
That it used to be good enough to have an AA and you could pass all the right tests and you could practice.
Isn't that a very American thing where this is going to get more and more complex and you're going to have to pay to go to school longer to do it?
And I think it's competition between nurse practitioners, PAs, and MDs. Everybody wants to have their level of education recognized as, these are air quotes, higher, even though it's different.
Right.
Higher.
Right.
And then that comes with the educational arms of each of our professions getting involved, and they're actually interested in keep on doing what they're doing, right? And making it seem more valuable by charging more money for it.
Right.
And so that loses sight of the actual, how do we address the need of the patients?
Yeah,
Because we're lost in our own little whirlpool at that point, in my opinion.
Right. And I don't see, how do you break that up and how do you keep that from...
It's healthcare writer privilege. We keep banging our head against that one.
That seems to be the prime, the first question you start with. I forget what Aristotle called that, the prime motivator or whatever it is. All right. Well, that is a half an hour of some knowledge dropped.
So if
by.
you're a high school teacher out there, and maybe it could be science, maybe it could be English literature, I don't know what's taught here, and you know that this exists now, maybe you do a little bit of, looking into it to make sure that I'm on task, on point here. And couldn't you talk to a kid and let them know that this is a thing? Couldn't you feed that dream? Because the community needs you to do it.
And just to put out there that these kids exist, the youth. I'm just out of high school. She was, but the youth that Persephone had recommended to you that ended up in just kind of on a whim, and because she knew somebody who knew somebody who knew you, got a job sort of at that very first bottom rung of the healthcare ladder.
Yeah, and
there.
she's actually going on now. She's got an EMT degree and looking at paramedic, wilderness medicine, talking about going into nursing school, maybe to be a nurse practitioner. Of course, I'm going to steal her for us. But, that kind of thing.
Yeah.
And she's actually talking about leaving the community so that she can improve and come back.
Perfect. That's it.
Yeah, let's send her to Cuba.
Yeah.
Start a fundraiser.
Yeah. That's wonderful.
She's amazing, and she'd be awesome here.
And it's that kind of person who would probably benefit from and be the biggest benefit that the community would benefit from a situation like Elam, going to school like that and then coming back to the community. So.
Right. And I think there's a lot more in Del Norte County, especially in the Spanish speaking.
Well, all right.
Youth.
That's our
Next
half hour.
dream. So last week it was, this is a bummer.
Yeah, that's
This week it's maybe not.
I see what you're doing. That's very meta of you.
I'll
Very good.
segue.
Well, any idea what next week will be?
I don't know. I'm still trying to get Mike in here, but I keep saying that. But he's, as we know, super busy.
Right.
I toy with RSV because a lot of people have it, but we're kind of coming on the downside of that. Although it'll pop back up again for sure. So who knows?
Who knows? Okay, we'll tune in and see. It is Health Matters with PA Lynn Szabo here on KFUG. Lynn, thank you much.
Thanks.